Greetings. Guess who's coming to you from a hotel? Does it look familiar? Does it start looking familiar? And this time I decided I was not going to check any luggage, which meant I traveled with one light. So we don't quite have the same lighting situation, but we're going to make it work because sometimes you just need to make it work. So, number one, I'm always excited to see you all. I really am. It really makes my day. And to be quite honest, today was rough. It was hectic. I worked late. I was driving safely, but very intentionally to try to make sure I got here in time to be on for you at 7, which lets you know I worked pretty late and I'm actually not done. But that happens for all of us. That's not just a doctor thing, that's a people thing, especially in the pandemic, because one of the ways it's been so stressful is between people quitting, being let go, and dying, that a lot of services, they're just understaffed, so it just changes a lot of dynamics. So I know out there you're working hard too, that you've probably been pulling longer hours. Work may be more intense than it used to be, so I know we're all in this boat together. But the thing I knew I needed to do was to show up for you. And not only did I really need to show up for you just because you all are great people, the second reason is because May is Mental Health Awareness Month, which brings us to our topic, which is why your mental health matters. I figured that was probably a really good way to set the stage for Mental Health Awareness Month. And I'm really passionate about it because I'm extremely passionate about your mental health and making sure that everyone has access to all of the tools necessary to have optimal mental health. And we're going to talk about why that is actually important. So, as we talked about, topic is why your mental health matters. I am your host, Dr. Ericka, Harvard trained double board certified psychiatrist and integrative lifestyle coach. I am on a mission to help you be better, do better, and live better. I do that through my adult telepsychiatry, my books, my podcast, Better with Dr. Ericka, and my corporate speaking. I do all of this to help busy people like you that show up for work, you show up for other people, you show up for your family, and you show up for everybody but you. I do all of this to put you back in your life. So let me have a couple of quick housekeeping things. First thing is, if you know someone that needs this, please share it. Sharing is caring. The next, if you know someone that needs this, please tag them. Can you do that for me? Just a little tag. The next, if you're watching it later, don't even worry about it. Just stick hashtag replay in the comments and let me know you are here. Sound like a plan? Deal. I'm realizing I probably should have shared this myself, but you know, we make things work. I don't want to have you here forever because I'm trying to share, but we'll see. I'm going to do like my friend Dr. Jaquel, and we'll see if I can successfully share something. But I don't know. Sometimes Facebook works for me. Sometimes Facebook is against me, and it's kind of like, hey, Dr. Erica, we're gonna make you work for it. And some days it's like, hey, Dr. Erica, we're not gonna make you work for it. We're gonna make this work pretty simple for you and let this happen for you. So, I'm curious to see what it decides it wants to do. So let's see if we can. No, see, you know what? It is making life way too complicated. So we are going to just, it is what it is. If you caught it here, you caught it here. If you didn't, you'll have to catch the replay. So back to actually what we are talking about is we're going to talk about why your mental health matters. So we're going to start it off with, number one, there are a lot of myths out there, including no matter what you do, it's not going to change how you feel. If you're depressed, you're depressed. It's just going to be that way. If you're not a happy person, you're not a happy person. If you're a grumpy person, you're a grumpy person. Nothing's going to change it. There are also myths out there like if your childhood sucked, your life is going to suck. It's just not going to get any better. If bad things happen to you, nothing else can happen. Or if you don't feel well or you're feeling down, then you're lazy. Those are some myths out there. But let's come back with some truth because we know that mental health issues are biological, just like diabetes, asthma, or any other kind of medical illness. And some of the symptoms for a lot of mental health issues include some decreased energy, some tired, some lack of motivation, poor concentration. So, a lot of times people may not necessarily be being lazy. They may be doing the best they can. You may be doing the best you can, and it just isn't enough to kind of get everything going. So, let's talk about a few specific reasons. So, one is, hey, it's a lot going on. According to the Centers for Disease Control, physician office visits for mental health is a primary reason. 55.7 million, 55.7. So that lets you know it's going on for lots of people. That's a whole lot of office visits. The next is that depression is estimated to cause, by the CDC, 200 million lost work days. 200 million lost work days. What does that translate to? Number one is decreases in work productivity. So businesses may not be able to do what they need to do. It for people that are missing work because of mental health issues, that it may mean that depending on how they get paid, they're not getting paid. It may mean eventually having to leave their job. It may mean having to go on extended leave where even if you are paid, you're paid less than your salary. So it can have this effect where it just snowballs. And then depending on how someone is feeling, that if you're not feeling good, it may be hard if you lose your job to identify a new one and to get another job because you just don't feel well. The next thing is during the pandemic, 4 in 10 adults reported symptoms of anxiety or depressive disorder. That's a lot. 4 out of 10. So there's a room of 10 folks, four of them may be on the struggle bus. So your mental health matters because a lot of people's mental health is challenged right now. The next thing is, oh, now we're back to ADHD. Oh, we don't need to talk about ADHD today. 21% of US adults, 1 in 5, experienced mental illness in 2020. And the thing we know is that this is getting worse. And then there are a lot of things that aren't showing up directly in statistics due to them being what I would call capacity drains, which is where before you had enough mental capacity that if something was going on and it was stressful, you still had enough room, wiggle room to still function. And now people's stress levels are so high, there's not that wiggle room to function. So we're seeing a lot of people have symptoms of things that may not necessarily reach the level of full-fledged disorder, but they may be having burnout or overwhelm or exhaustion that is really impacting your ability to function. Maybe not to the level where you're impaired and you can't work at all, but to a point where it's still problematic. And that can still happen. The next thing is just to know your mental health matters is because you deserve to have good mental health. You were created to be the best version of you can be and to make a difference in this world. And it doesn't have to be Oprah difference. A lot of times it may be the ripple effect of how you impact lives one on one. But you were created to actually enjoy this life and not to simply be surviving. And good mental health is part of making it past survival. And so many mental health challenges are treatable, even if they're not full fledged disorders. And the thing that hurts my heart is when people are struggling out there and they don't need to be because there's help and they either don't know how to find it, there's so much stigma, they're uncomfortable, or they're just afraid of what someone will tell them or how they will treat them. So I just want you to know that I know that you deserve the best. And the other thing is it's very common when people have mental health challenges. There have been a lot of studies, especially with depression, bipolar disorder, and schizophrenia, that for some people, especially schizophrenia and bipolar disorder, the life expectancy starts going down and people may have increased other medical problems. So your mental health actually circles back to your physical health. Some of it is just purely biological. And then there's also the after effects of these illnesses that a lot of times people are not eating well. You may have less concentration. You may have less appetite or more appetite. If you're having difficulties with motivation, you may not be able to follow all the directions you needed to do to take care of your other medical conditions. It's not uncommon, especially for people with depression, to not necessarily be taking their medication for other things. But this can also affect your physical health, along with just the effects of cortisol or increased, I don't want to say epinephrine, okay, and adrenaline. Um, but I just don't want you to have to deal with that. I don't want your body to also have the side effects or the impact of mental health conditions when it doesn't have to. Because not only do I want you to have a high quality of life, I want you to have a long life. So those are some of the reasons your mental health matters, which is number one, a lot of people are struggling. Lets us know it's really important. And a lot of people are having challenges with it. And by there being so many challenges, there are also opportunities to make it better and to get you past survival. And by having optimal mental health, not only are you going to have a better quality of life from a spiritual and emotional sense, but it also often improves your quality of life from a physical sense. And we don't want your mental health negatively impacting your physical health. So I just wanted to take a few minutes to talk to you about why your mental health matters, especially since it is Mental Health Awareness Month. Thank you so much for joining. You know, you can find me on Tuesday nights at 7 p.m. with Growth Group with Dr. Ericka. As I said before, you can share this. You can also tag people that you know that need to hear this. And also, you can hit hashtag, I can't talk, put hashtag replay in the comments. Thanks for dealing with all of my lighting from my hotel and for being here to help cheer me up on a pretty rough day. But I want to encourage everyone that if you feel like you're struggling or you're starting to feel just a lot of overwhelm, is that go ahead and get checked out. One place, if you're in one of the states I'm licensed in, is I'm a big fan of the mental health check up, and just get checked out and see if there's anything that can be done. Doesn't necessarily mean you have to be on medicine, but you deserve to have the best mental health. And right now, it's easier than ever with there being so many virtual options. So you can find me below at askdrgoodwin.com, askdrgoodwin.com, and there are plenty of other people to help you too. Also, if you need a little bit of inspiration and you're missing me, you can always check out my podcast, Better with Dr. Ericka. I encourage you to check out the episode that released today. It actually features me, and I talk about how to simplify your life because sometimes feeling like it's so complicated causes so much angst, overwhelm, and a capacity drain. So I talk about ways to simplify your life and decrease that anxiety. And as you know, those come out on Tuesdays. You can always binge listen. You can find me at betterthepodcast.com or Better with Dr. Erica on all platforms. And after that, I just want to tell you to take good care of yourself. Be kind. I will see you back next week at 7 p.m. Eastern. And I appreciate your time. Bye. Oh, wait, I got a comment. Thank you so much, Sue. Oh my gosh, you are warming my heart. It's so good to see you. Thank you so much. I really enjoy podcasting. It brings me a lot of joy. So I'm glad that you find it helpful and that you listen. So thanks for showing up, but also thanks for showing up for yourself. I'm about to get out of here because I'm not going to keep everyone here a long time, but thanks for commenting and making my day. Have a good night, y'all.